Welcome back, everyone, to GuideWell Insights Lounge. This is Kate Warnock coming to you from day 2 of the Health Innovation Summit. I have with us the president of GuideWell, Dr. Rene Lerer. Rene, welcome to the interview.
Thank you, nice to see you.
Rene, one of the predominant themes at the Innovation Summit is value-based care and the evolution of value-based care. As the president of the health insurance company on GuideWell, where do you see value-based care going in the future?
So value-based care is sort of a way station. We're going down a continuum of going from a fee-for-service to a value-based environment where at the end of the day the goal is a collaboration between us and between our providers and the stakeholders in the community to truly deliver care that generates high quality at appropriate cost in the right environment. The first step is in a value-based care environment where we're working with providers to encourage them and to align them with the patients and with us to provide the highest level of care and to incent them and to create a financial proposition that creates incentives to do the right thing. So to move from a fee-for-service environment where incented for the amount you do to a value-based environment where you're incented for the outcomes that you create. Everything that we do, whether it's with ourselves or our providers or hospitals, is really for the benefit of the patient. And as we sort of move forward, our goal is to keep in mind, how do we create an environment where those who are doing what they know how to do best have that responsibility. Hospitals, providers, physicians, ancillaries do their thing. We do our thing, align ourselves so that we can all be positioned to succeed for the benefit of the patient.
You know, Rene, you were presented recently at the Florida Association of Accountable Care Organizations, and you described the current state and the future state. Are there some key milestones that we should be aware of on our way to that future state?
So I think the first piece of that future state is to understand who all the stakeholders are surrounding the member, and then to develop an environment of trust. Basically, this is about trust. The providers need to believe that we, GuideWell, or Florida Blue as a not-for-profit, have a mission in the community in the state of Florida to improve health care for citizens of the state of Florida. That has to be a given, and that trust takes time. It's an environment where that trust maybe hasn't always existed, but we need to convince each other that this is for the benefit of the patient. So number one in that continuum is trust. Number two is being very clear and very open about what our mission is, what their mission is, and what the opportunities are to succeed. So I think in that trust environment, transparency, openness, commitment to success to the benefit of the patient, we begin to move down that continuum, and that continuum becomes much more collaborative, much less competitive, much less confrontational, and much more in terms of how do we work together to manage the quality of care that is delivered to our patients for their benefit at in a cost-effective way.
Okay, tremendous. So talking about that collaboration and really keeping the patient at the center of care delivery, building trust. I know that you recently enacted back in Florida a brand new care delivery model which is locally based, very holistic, and it's meant to help people manage their chronic conditions. Can you describe a little bit more about what this model is meant to do?
So we call the model PODS, place of delivery, and the goal is to bring healthcare as close to the patient, to the member, to the consumer as it can be. Clearly, as we've heard in the conference here, and we've known as conventional wisdom for many years, that a small percentage of the population drives the majority of the healthcare costs. You hear 5% is 60, 20% is 80. Not sure what the right number is, it varies. The reality is there's a very high concentration of expense in a reasonably small number of people who are sick. Those people need help. It's our responsibility to work with them to help coordinate their care, to understand their environment. It isn't just about managed care. It isn't just about how many days are they in the hospital, do they need that MRI, or should they get that medicine. It's really about the environment that they live in, and how do we create an environment for them that will create improved health care. Whether it's where they live, whether it's how they access health care, whether it's whether they have food to eat, whether it's the social settings that they're in. Do they have a community of caring around them? Very difficult to understand that for these chronically ill patients from a distance. Our goal is to put together multidisciplinary teams locally to include physicians, care managers, social workers, pharmacists, perhaps psychologists, to really understand the environment that the patient is in, understand it locally, understand the local community assets, work collectively with providers in the community so that we can circle that member, that patient, that consumer with what they really need for those patients who are most in need and have most complex illnesses.
So that sounds like a tremendous new opportunity for our members to enjoy a very holistic point of care, but I want to know too, I know that under your purview back at GuideWell, we have many innovations that are being piloted. How is it that you evaluate a pilot that's worth scaling and letting more members perhaps enjoy the benefits of it?
So clearly, whenever you do a pilot, by definition, we want to try something.
Right.
We have an assumption, we have a hypothesis that this pilot will do certain things. So number one, a pilot is a test. You need to know how you grade the test. If you do a pilot and don't know whether the outcomes are good or bad, because you haven't evaluated them in advance, how do you determine that's a pilot's helpful? On the other hand, you can't be too prescriptive, because sometimes you get benefits that you didn't expect. So our goal is to set up pilots, understand the value proposition we think they will bring, create the environment that has the greatest likelihood of success, be open-minded to the data, measure what we've done, and then compare it to our expectations and identify collateral benefits that perhaps we didn't expect or didn't see, and bring all of that together to determine, is this scalable? Does it make sense? Have we targeted the right community? Have we targeted the right population? Sometimes you have good ideas and you make not the right decision about how to implement them. Doesn't make it a bad idea. Just you need to figure out a better way to implement.
Right.
So it's really to have a defined period of time to understand what we're trying to achieve, how we achieve it, and review the data and make sure we're on the right track.
Okay, I'm going to pivot a little bit.
Okay.
We've had a lot of headlines recently about specialty pharma, and again, in your purview, you certainly want to make sure that our members benefit from the right kind of treatment, but we also want to contain costs. So how do we balance? What's the right way to strike that balance?
So again, there's tremendous press lately about the cost of these drugs, the selection of the drugs, who gets them, pricing of them. There's been lots of stories, most recently about a drug manufacturer that took the price of a drug, increased it hundreds of fold. The reality is, this has got to stop being a competition. We're in an environment where everyone's trying to maximize their income. And at the end of the day, there will be new drugs, there will be expensive drugs. We have to do a couple of things. Number one, we have to make sure that the drugs are efficacious, that they're not Me Too drugs, that they don't copy something that's already there that doesn't add incremental value. That's our job and primarily the FDA's job. We then have to make sure we have the right criteria of which patients are selected to use those drugs. And then we have to collaborate with providers and manufacturers to say, look, let's talk about what's in the best interest of the patient. Let's create an environment where we can support each other, but not create an environment where we move into a world of haves and have-nots. We will enter a day where not everyone will be able to afford these drugs. We're probably there already. The copays and deductibles are going up, separate benefits often for specialty drugs. We cannot be in a system where people can't access the care they need, primarily because of price, and we need to collaborate again to identify win-win situations for all the stakeholders so that patients benefit, and we don't get multiple classes of healthcare delivery.
Absolutely. So we certainly want to keep it fair and equitable. Rene, you've been in the health industry for many years and been a leader for most of that time. What is it that you draw against to help keep the employees focused on the future, on our goals, our KPIs, and not become distracted by industry movements like consolidation?
So number one, look, the one thing you always have to remember, and we tend to forget, we all do, it's about the patient. This is healthcare. This is not a bank. This is not buying cars. This is healthcare. This is about people's lives. There's nothing more sacred to someone than their healthcare. And so when things are not going well, or we're having trouble with a given program, if you bring yourself back, step back and remember why you're doing this and what the value is, that we're all in this, whether we're healthcare professionals or work in the industry, it's to benefit members. And so when you're having a bad day or things aren't going well, you have to step back and remember that mission. This is about taking care of those that are struggling, that are in a difficult time in their lives, that they need help, they're reaching out. Our job is to help them, not hassle them, figure out what we can do to make their lives better and move forward. Clearly, we have to have some financial success to survive, as do the providers or the docs or the hospitals or the manufacturers, drug manufacturers. We all need to have financial viability to provide that care, but we have to surround ourselves with the notion this is for the benefit of the people in society in a way that we can then help each other survive financially.
Outstanding. Well, Rene, thank you so much for spending some time with us here today at the GuideWell Insights Lounge. Look forward to having you back again. Enjoy the rest of the summit.
Thank you.
This is Kate Warnock. We'll be back again in just a few minutes.
Great. Thank you.